Welcome, everyone, to this episode of your Freedom Hub's Free Market Cash Patient. I am your host, Jeff Cantor, along with my co-host, Charles Froman. We're sponsored by the Freedom Hub, which is available at your-mp.com. And we're definitely the disruptors intersection for sure, as you will see tonight, is no exception. We are actually running some problems out there, and we're going to try to address that a little bit yet today. But there's a problem if you haven't figured it out, and most everybody's kind of figured out where the issue lies. And actually, we can change the name on that entity in the middle to government and big pharma or whatever you want to kind of call it. But somehow it's between you and the patient and the doctor, and that's the problem. And information is a mixed bag too, because who are you going to believe? And everybody's got vested interests and all the rest of it. So that's trouble as well. Now, the other side of it, real quick, is a diversion. We do run a similar show during the day on Wednesdays on more broad-based freedom issues. You'll definitely want to take a look at this. These are the links to go take a look at the archive, and you can certainly participate in the show. And as a matter of fact, we definitely want you to go to the main site, because here's where you get to really see everything in depth. So let's take a quick detour. When you get over here, there's an awful lot of drop downs, and they're adding all the time. But under the home, you'll see webinars and continuing the conversation. Well, the webinars is what we're doing today, but continuing the conversation is a big deal, because after the conversation today, you're going to probably want to get involved potentially. And here's how you're going to do it. You get to connect with all of the guests that have been on here in the past to see what they're up to and how you can help them out. And as a consequence of that, we also have a similar mentality here under freedom, fighting for freedom. If you click on that particular tab, you'll see there's a variety of issues that you need to address. And there's a lot of stuff that's out there that's problematic for sure. But then here are all these different organizations that are trying to help further the cause of freedom on a whole variety of fronts. And here's your way to find out about all of them. And you'll see there's some other new tabs and drop downs coming, because we're having a breakout on medical cannabis is coming. And so we'll see some stuff we're going to be breaking for that on here as well. But let's go back to the webinar tab. So again, if you're at home, go over to the webinar tab. You end up on this link, and here's a little breakout of the webinars. Here's a breakout on the two different shows for the day. Here's the one on the right. We'll come back to this. But if you continue down, you'll see here's your chance to see the ones coming up, so you can make some plans on your calendar. And here's the really important part. Right down here, here are the links to all the platforms where these get archived. So on Monday, because we do it between now and over the weekend, they're posted. You come back, and whatever's your favorite one of these, you click on it, and boom, you're in here. And you'll see, here's where you're going to figure out who you want to continue the conversation with, because there's all these fantastic speakers. And sadly, a lot of these topics could be 6 months or a year old. They're just as current as if we're recording them today. The problem is there. So you need to be a participant, not an observer. So that's kind of where we're at in general. But let's zoom back into today. And here's where Charles is going to jump into the fray and give us a good introduction on our guest today.
Gladly, Jeff, and welcome, Scott. Dr. Jensen, we're pleased to have this topic and you tonight. Jeff and I are big believers in the integrated potential of healthcare, mainly because both as libertarians and fans of good health, we don't know why it isn't as integrated as it should be. So many people go not just to their primary allopathic doctor, mainstream doctor for pills and standards of care diagnoses, but also they go to naturopaths, they go to biologic dentists, chiropractors, acupuncturists. In fact, the natural health space is approaching $100 billion in value. And when another of our guests on this broad topic of integrated care presented a year ago or so, Dr. Benz, who has that artificial intelligence functional assessment that is part of our sharing HSA plan pretty soon, he presented how to coach your doctor. because patients are self-diagnosing. They're learning more than their doctor in many cases around the alternative complementary treatments that they go to, because the pop a pill approach, or just go get the surgery, isn't working, especially for all these chronic diseases. That's where functional medicine comes in. Scott actually is a member of our Sharing Health Savings Account plan that was featured in Forbes and is becoming such a great solution for small business type people who are otherwise priced out of the Affordable Care Act. He heard about us listening to a mutual a light person, Mary Ruwart, an icon in the liberty movement, who presented also a couple of years ago on her book, Death by Regulation. And I was just reading a book how the FDA is trying to kill natural health care with regulation. They're calling it Operation Quack Hack, which is just such a condescending name. It's like any bureaucracy in health is owned by pharma. They sent out 3,000 letters, none to the doctors who are the leading cause of death in the country, almost, from hospital infections and mistakes, et cetera, in the mainstream health market, but to people who supposedly are offering illegitimate cures for COVID, things that actually work, like vitamin D, colloidal silver, et cetera. So how dare these integrated entrepreneurs try to practice the art of medicine and see what works? If you go against the pharma-owned bureaucracy, you won't get very far. So with that, Jeff, let's hear from Scott. Oh yeah, hold on. So the goal here is, we had Ruth Linenger recently present from Dutchess Health on the idea of having an integrated doctor be the entry point for big group health plans. And we know that people want integrated entry points, not just allopathic. And we know that doctors are trying to figure out how to survive in the new normal. So we really want this lesson taken seriously by the doctors to up their game, to add integrated to their practice. We want patients to demand more of an all of the above strategy. So we're very serious about helping this segment of the market to improve the quality of the entry point in healthcare. So Jeff, that's the intro.
All right, there you go. Well, Dr. Jensen, you've got quite a little task there that Charles has laid down that gauntlet. So change our minds, convince us.
All right, I'll do my best.
I'm giving you the screen.
Okay. All right, I appreciate Charles and Jeff having me. And I'm going to share presentation today a little bit about integrative medicine. I could say a lot of things, but I thought it would be effective to share a case, so you can see how patient and doctors can kind of work together. Charles was mentioning sometimes physicians need to be coached a little bit, and I'm not the exception to that. So you'll see that I got a little coached by my patient in this case, and it made the case turn out better than it would have otherwise if I hadn't been willing to listen to the patient and a different idea that I hadn't heard before. So this is us now. My 7 kids, because of COVID, one of the positive things is my 2 older kids came home from what they were doing, college and their mission, my son's mission. So we have all of our 7 kids here just for this little window of time. So in a beautiful place. This is just a background that I was actually a traditionally trained MD in Wisconsin. Did my residency in Scottsdale, Arizona, and that's where I'm originally from. So it was kind of going back home. I was board certified in family medicine, and then integrative medicine. And then while I had our practice in Queen Creek, Arizona for 13 years. I did trainings with the U of A, with Dr. Andy Weil and colleagues at the U of A. And then I did the Institute of Functional Medicine, which is the IFM. Then I did some additional trainings with, one of them I'm going to talk about is with Dr. Cicero Coimbra in Sao Paulo, Brazil. And that was a fun trip to be able to have to do some training there. And then William Walsh in Chicago is my most recent training. This is just a reminder that my life changed about 6 to 9 months ago. I sold my practice, and primarily I do telemedicine at this point. I still see some patients in person, but I out my window, I take care of these chickens from my office. So we're in more of a rural setting at this point in the White Mountains in Arizona. I wanted to start out by, which I think is a great analogy for how medicine can get better when we bring in old and new concepts and combine them. There's a scripture in the Bible says, every scribe which is instructed in the kingdom of heaven is like a man that is a householder, which bringeth forth out of his treasure new and old. And I've always liked this because, you know, people that like a nice house, they have antiques in their house, and then they also have technology in their house, and it makes the house better, more beautiful, more of a great space to be in. And just like that, a physician I believe should be the same way. They should be bringing forth things new and old. So using technology, using new drugs when they're needed, and then also not neglecting the things of old that work. So unfortunately, in what happens in history is that paradigms change, and so when paradigms change, we unfortunately leave things in our past that are quite valuable, but we move on and we forget those good things. So I see integrative medicine as a way to rediscover the good things that have been around for hundreds and sometimes thousands of years. So it could be herbs, vitamin supplements, using other systems of medicine, using treatments from other fields, and collaborating with providers in other fields. And then the classic medical therapies, the things that are old, and then the modern medical therapies, the things that are new. And I find that when you use all of those things, that you get a better outcome for the patient. I wanted to present this case. This is a patient that I had about 5 years ago. She's a 35-year-old female, and she came with a history of dizziness and a lack of coordination and right arm weakness. And she had also said that, you know, for the last year, I've had these night sweats off and on, and I don't really know what they're about. And then I couldn't pick up any findings on her vitals or neuro exam at that time. And then she had a mildly low vitamin D, and her other blood work was fine. But subsequently, on MRI, we did find white matter spots on her MRI. She went to a neurologist, a general neurologist in the community. Additional blood work did show this IgM positive for Lyme, which kind of threw everybody off a little bit. So the neurologist got a second opinion from Barrow's Neurologic Clinic, which is where a lot of people go for a good second opinion here in Arizona. And they did another MRI that showed a large enhancing lesion in the left hemisphere and other enhancing lesions in the C-spine and T-spine areas. And then the patient started getting more symptoms. She started to get spasticity on the side. And the infectious disease consult was obtained while she was in the hospital, and they ruled out Lyme officially. And the diagnosis was multiple sclerosis. So that was what happened with the aid of the specialist, as she got that diagnosis. She was offered standard therapy, but she was more a lover of natural medicine, so she wasn't ever going to do the standard therapy that the neurologist offered. She researched on her own something I hadn't heard of called the Coimbra protocol, and she asked for support, and she said, "Can you help me by ordering the blood work? Can you kind of be a support in getting those labs through my insurance?" And I said, "Sure, I'll help you with that. Even though I don't know what it is, I'll look it up." So I looked into it, and I found an article where the protocol that she spoke of is actually used. And this is the article from a study, a journal dermatoendocrinology. It's in 2013. So the last person there is Cicero Coimbra. He's the doctor that started this protocol for helping people with using vitamin D. So in this study, they gave 35,000 units to patients with psoriasis and vitiligo, and the patients all got better. So here's an example of psoriasis before the study and then after. And the study was for 12 to 16 weeks in length. And then this is a patient with vitiligo, and you can see the depigmentation in the face getting better with the vitamin D over time, and then the hand starting to get new pigment as well for this patient. So meanwhile, we to help my patient, we started 20,000 units of vitamin D. She went on a low calcium diet. Her vitamin D went up to 148, which is quite high. It's above the normal. The parathyroid level went down. She had some improvement, but she still had a relapse. And so we increased the vitamin D to 30,000. Then we increased it to 50,000, and just noting that she was about 61 kilos, so just an average size. Other protocol supplements were added, including riboflavin and magnesium. And then subsequently, her dose got as high as 100,000 units of vitamin D. That's a lot of vitamin D to take in one day. But we got the parathyroid down to the goal, according to the protocol, to have it be between 7 and 9. Her symptoms went into complete remission at that point, and the MRI showed no new spots on it. So all the enhancing lesions went away. She still had old damage, but she was able to have all of her symptoms of spasticity stop, and she was able to function normally from day to day and take care of her kids. And today, over time, we've been able to reduce the vitamin D down. So now she's down to 70,000 units a day and doing fine, and still has been able to keep into remission with a normal MRI. So I went to Brazil after seeing that, and I met Dr. Cicero Coimbra. This is me just as I'd finished my training and was leaving the hotel. So it was a 1 week training to learn how to use vitamin D to help people with severe autoimmune diseases like multiple sclerosis. While there, this is a slide he showed me. This is the connection that I'm going to talk about today just briefly between infections and autoimmune diseases like MS. Vitamin D is important in helping in both of those areas in our body. This is the good work of one doctor who's kind of forgot. What happened was, this is a doctor who was treating tuberculosis using vitamin D therapy. And once anti-tubercular drugs were discovered, all of this work was pretty much forgotten. So he did therapy by putting patients out in the sun, high in the Alps. So at high altitude, your vitamin D, your sun exposure, the intensity increases. So he was trying to do that to help these patients with tuberculosis when there weren't any drugs to treat them. So they had the sanitarium high in the Alps, which now it's a resort. It's not used anymore for that. And these are the first patients. These are the patients, these young children with tuberculosis. They would come for 12, 18 months at a time, and they would be treated by Dr. Rollier and colleagues. And this is how they do their school. They did outdoor school. I mean, this is how we could do our school during COVID. That would be so much more fun than being in the classroom. And you can see they're all exposed. Everyone is exposed as possible, just wearing their underwear so they get lots of vitamin D. And then what they were treating for the real severe cases was a disease called POTS, which is an infection in the spine that causes a loss of bone and the structure of the spine, and it causes a kyphosis, or a hump on the spine as a result. This is an example of what it looks like. We don't see it anymore, thank goodness, but it's a wedging of the spine because of the infection of tuberculosis. So because of the power of vitamin D, it was able to help these kids get better. This is an example of a severe case. what it looks like in the anatomy on a side view, and what the patient would look like with a side view. They still have cases in India today of this. This is a patient before and after. This is what she was like when she came. Patient of Dr. Rollier, and this was like 15 months later after she'd had her vitamin D therapy, completely straight spine, and all it was vitamin D. So, you know, a tuberculosis drug can't do that. So it can get rid of the infection, but it's amazing what vitamin D could do for these patients. And then here she is. Here's that same patient photographed after 25 years after leaving her treatment, and she's married, and she's doing sports, and her health continued to be really good throughout her life. This is another little guy that looked like he was near death's door, and then after a year later, he was looking pretty healthy, and you wouldn't know that it was the same patient. So vitamin D, basically, this is just a cell to show how vitamin D becomes activated. It goes into the immune cell. It's activated by an enzyme called alpha-1 hydroxylase. And then at that point, it goes through some pathways to get to the vitamin D receptor in the nucleus. And then all the great stuff happens. All the proteins are made that lead to us having better immune defense. And also, it helps us regulate our immune system to keep it from becoming autoimmune. So people that have trouble with this pathway here with the T regulatory cells, they develop autoimmunity when this is inadequately stimulated and the proteins aren't created. So vitamin D is one way. If you give patients that have a really poor enzyme here, you give enough vitamin D and it can get activated, you can actually have this reaction occur in patients that have a slow enzyme. And we know now that people that have autoimmunity have an enzyme problem at this enzyme right here. And some of them have vitamin D receptor problems. And so we know now from this paper in 2010 that multiple sclerosis is associated with a slow enzyme at that enzyme that activates vitamin D. So it makes it work. So you have all this vitamin D floating around and it's not working for the patient. So just in summary, I wanted to bring up this case because I think the old medicine is really integrative medicine, and it's just a rediscovery of things that have worked for hundreds to thousands of years. There's still new technology in medicine that's valuable. We don't want to throw out all the good stuff when people need it. It's wonderful. What I have found is that a combination of the two is really better, and it gives doctors more tools, and it gives patients more options, and really better outcomes for people. Now there is training available for physicians. The first link is the U of A, the University of Arizona. That was a 2-year fellowship, and doctors can do it while they're in practice. And the Institute of Functional Medicine is about a 2-year process to be certified. And it's a perspective of integrative medicine that's very helpful in this regard. And then the Walsh Institute was also a helpful training. And the doctors that had the knowledge there have had it since about the 50s, but a lot of it has just recently become available for training 70 years later. So again, this is my family now. This is our nice, beautiful setting. And it's been a pleasure to be able to talk with you today. And I'd love to answer any questions that you have.
All right, that was fantastic. I'm going to pull this sharing down. Okay, there we go. Got some more people coming in here still. You know, it's interesting that everything that's old is new again. And it's just like we got so distracted by this new shiny object, we forgot already what actually did work. I always jokingly say computers are great, but once in a while, paper and pencil works even better. You know, it kind of depends on where you're at on stuff. But you're right, and it's kind of funny. I'm and part of what we do, we're engaged in stuff in the senior market. So some things that are preventative you can get once you turn 65, but before that you can't. Well, it would make more sense to be preventative until at 65, you usually got your problems are pretty full blown by then. It's a little late to come in the 12 hours. So it's great what you're doing in that regard. So let's
Yeah.
open it up for some questions. We got some great guests here today. Charles, why don't you kick us off?
Gladly, Jeff and Scott, thanks for that presentation. I think a lot of people would love to go to a medical doctor who also had functional knowledge. So you can have the all of the above experience. Um, how has that, a couple questions, how has that transition impacted you as a person in your practice, going from straight MD to integrated? How has it changed you and your life as a doctor? Um, Often with our innovative doctors, what they want is to get to that space where they can practice medicine again, the art of medicine. Does that kind of go with your experience as well?
Yes, I think what happened is we started taking more time with patients, so that was more satisfying. And I take more time now than I even I had in my practice with telemedicine. So it's extremely more satisfying for the patient and the doctor to not be rushed and have to take, have only 5, 10, 15 minutes at the most. So I take 30 minutes. With a patient in person, I take an hour. I still bill insurance. I take cash. I have lots of ways to accommodate people. It's much more satisfying, and mainly for me, just to have more tools to help people. Because I think the frustrating thing is when you have one drug for a condition and that one drug doesn't work. I mean, what can you do? In the early days, I didn't have a whole lot, but as the years go on, you can add things as you get more training and knowledge. So that's been satisfying for me.
Sam,
Jeff, I think,
Sam,
go
I see
ahead.
your hand up.
Yeah, thank you. Dr. Jensen, fascinating. I can relate to this to a great extent. I want to share a couple of personal experiences without being too revealing, but I have a quick question after that. And I think the observations I'm going to share might be interesting to the audience as well. So I'm from India, and I grew up in India, but I've lived most of my life here in the United States. And while I was in India, this is going back, gosh, a long time ago. I was in my early 20s. I was pretty sick with a liver condition, simply out of malnutrition and probably neglecting my health. And I tried all kinds of allopathic medicines and treatments for a couple of years. Nothing worked. And finally, I went to an Ayurvedic doctor that was pretty well known. And keep in mind, for 2 or 3 years, I've been in miserable health and feeling like I can't get through my day. And he gives me this potion that I'm supposed to drink with milk a couple of times a day. It just looks like dried grass. And he said, try this for a couple of weeks and see how it goes. And I think I had it for a day, maybe 2 days, and I felt like a new person, like I'd been reborn. That's how quickly it worked. And then about 15 years later, I moved to the US. I was given penicillin by an oral surgeon, even though I'm severely allergic to penicillin. And as soon as I took the oral penicillin, my insides burst. And for about 2 or 3 years, I was in a sort of pretty bad shape with what doctors call something similar to Crohn's disease. And nothing was working, no treatment. I was on all kinds of steroids and all that. Went back to this doctor in India, this Ayurvedic doctor. He didn't ask me any questions, felt my pulse, gave me some medicine, and literally within a week I was cured, and I've been fine since then, right? So this is my personal experience. It works great. The challenge I have is I would not go to any Ayurvedic doctor because you don't know if they're any good or not. This person's world famous. He is very well known. Half of his patients waiting in the waiting room for literally most of the day just to see him were Westerners, from Europe and the United States. So that's part of the challenge in these alternative forms of medicine, because they don't ask you anything. There's no certification for it. He just feels your pulse and knows what's wrong with you. It's almost like magic. So that's just one observation I have about these alternate treatments. The quick question I had for you, Dr. Jensen, is you talked about vitamin D. What's the risk of taking too much vitamin D on your own, or do you have to go through sort of a proper medically supervised process doing that?
Yes, I mean, that's a good question. Like in the protocol with Dr. Coimbra, I mean, we monitor the blood work on a fairly regular basis in the beginning, and we give a patient a big list of all the things that they could have wrong. The main symptom that people have that's most common when they're taking too much vitamin D is nausea. So, I mean, the danger of taking too much is you can have too much calcium going into the kidney, and it can cause kidney problems. We usually can pick that up on the blood work before the patient even has symptoms, and then we lower the dose. The good news is, I mean, when most vitamin D problems, if people are having a problem, we can catch it usually on blood work, or they tell us they're having nausea and we change the dose. But yeah, you want to make sure that if you're taking more than about 4,000 units a day, the Institute of Medicine says, that you should probably have a doctor monitoring the level. And as long as people are staying between 30 to 100, they're likely not going to experience any problems or symptoms. So a level is good to check. It's even out of pocket, it's around $40 to $100 to check it. So it's worth checking once you've been on a certain dose for about 3 months. It's reasonable to check at that point.
I see. And would it be reasonable to say that the same should be applied to any health supplements that you take on your own, over-the-counter health supplements? Is at least have your doctor be aware of them and possibly monitor for any side effects or conflicts? I've never had a doctor ask me about my supplements, what supplements you take. They've never asked me.
Yeah, they should. I mean, a doctor that will ask about your supplements, mostly that's going to be your integrative doctors, functional medicine doctors, natural doctors, NDs. They're going to ask you those questions, and then those type of doctors will check. If they see anything that needs to be checked, they would check it. But a few other things that you'd want to make sure if you were taking too much would be selenium, chromium. Those and zinc. Those can give people toxicity. So sometimes, I mean, it's good to check a level if you're taking generous doses of those supplements.
Got it. Thank you very much.
You're welcome.
Very good. I see one of your patients is chiming in here. Dorina is in there. You can go ahead and chime in, please.
Hi, Dr. J.
Hi.
It's Dorina. And I was just wanting you to relate my story to the group in that while being seen at Mayo Clinic by the nephrologist, he gave me a scare because according to him, my vitamin D range was too high, as well as my vitamin C. And because he had known of patients who had to go on dialysis due to high levels of vitamin D, vitamin C, and because according to their range, my levels were too high, that I should completely stop. And once I did stop taking my vitamin D, and I know what an impact that had on my well-being. And I was just feeling so out of sorts that I had to go back on it. And I think in my perspective, it has been so beneficial, not only with my kidney issues, but also my liver and my now neurological issues.
Yes, Doreen, I remember that. I remember that exactly. I mean, in fairness to the doctors, what happens is the doctors that see, one patient out of, 10,000 who has a problem, they remember that one time. So they're nervous about, other people who are taking a dose. So, I mean, as long as someone, a doctor who's, versed in how to monitor vitamin D checks it, I mean, we're able to usually tell, like I say, by kidney function. When the kidney is happy, usually your vitamin D is okay. You can be at a higher dose if your kidney is not showing any signs of strain. And then also we check a calcium in the urine. If the calcium in the urine is normal, then that person's vitamin D is fine. The other thing that we check in the protocol is a parathyroid level. So endocrinologists usually always check a calcium, a parathyroid, and a vitamin D. They usually never check any of those three alone unless they're checked together. And so that's one of the things we do to monitor D status. And so you can better advise somebody if they're taking too much or too little. And it's possible some people are sensitive to low doses of vitamin D. I've had people take very low doses and have problems. So most people don't, though. Most people tolerate generous doses, and as long as they're staying in that range, 30 to 100, the risk is very low of problems.
Very good.
Yeah.
Bharat, I see your hand is up.
Great presentation. I just came back from India a few days ago, and I had a question about autism. Have you seen any alternative medicines which can impact this population? And my second comment was, I saw one of my doctor friends in India. He was using vitamin C and vitamin D for treating COVID patients, and he was very successful.
Yes. So on the autism piece, I have not as much training as other practitioners, but I'm familiar with Dr. Walsh, William Walsh. He has a treatment that he uses that tries to build up a protein in the brain that protects the brain from heavy metal toxicity, and they've used that in autism with some success. And Dr. Coimbra has used the protocol for vitamin D with some success in autistic patients. So those are the two that I've been trained in. But I know that with autism, there's even more than that. I mean, there's so many treatments for autism to try. I think that's the overwhelming thing, for a parent that has an autistic child. The other thing that I've found in the patients with autism is about 60 to 80% of them have a condition called pyrrole disease, and it's something that you can pick up on a urine test, and it's very easily treated with vitamin supplements, and so you can help any mood disorder or attention problem that goes along with the autism. With that type of treatment, it can improve aspects of the autism and make it a little bit easier for the patient and the family. Then your other question, remind me.
Not a question, it was a comment. One of my doctor
DNC.
friends was treating COVID patients with vitamin C and D,
Yeah.
combination, with really a different combination, and he has been highly successful,
Yes.
He was dean of a big institute in Mumbai. And, I can introduce you to him. He's doing, he's doing very well in that. He's doing a lot of research in that space using vitamin C and D for COVID, and
Yes.
without less side effects,
Yeah, that is good. I've had one of my patients that'll remain nameless. He treated his pneumonia with vitamin C, with me sort of overseeing and watching to see what would happen, and completely resolved his pneumonia. I mean, vitamin C IV or just high oral doses, I have seen it help COVID. In our family, when we all got COVID, my daughter, who didn't have any symptoms from the COVID, she didn't lose her sense of smell. She recovered the fastest. She took 10,000 milligrams 3 times a day of vitamin C for about a week. And the rest of us had a few more symptoms, and some of us lost our sense of smell. But we have seen in China and in cases here, we've seen improvement as well with vitamin C. Vitamin D is definitely helpful. We've found, at least it's better to have your vitamin D normal before you get COVID, because like I was showing in the slide, you have to have those proteins already in place when you get COVID. Even though it can get you those things up in days, get all those proteins made. You want to have those proteins all ready to go. So it's good to take. I've told my patients, take 4,000 to 5,000 units of vitamin D during COVID season or during flu season, just to make sure your vitamin D will be normal in case you get it. And then vitamin C is really, I agree, that's the best treatment I've found as for a vitamin with COVID. It's been excellent.
Right.
So
Just in autism, you said pyrrole, right? What do you test? What is it called?
Yeah, pyrrole. So it's Pyrrole, pyrrole disease. There's a cryptopyrroles urine test. There's a lab called DHA Laboratories that does it. But you can get LabCorp can do it. I think Sonora Quest can still do it through Quest Laboratories. So you can get that test run. It's just it's a bit of a strange test. It's a frozen urine. So, but that's an excellent test for someone with autism to see if they have it.
Okay, great. Thanks.
Dr. Campbell, see your hand up.
There, I got unmuted. Hey, Dr. Jensen, wonderful presentation, and
Thanks.
congratulations on your career path. You know, we see so many docs, primary care docs, who are being, you know, their love of medicine is being extinguished by the medical industrial complex. And I just think there's so much value in alternative treatments. We have all these chronic diseases, and I think going to a 7-minute, you know, visit with your primary care doctor for all of the chronic diseases we currently have is just not really productive use of those funds. So I just hope we can find ways to expand what you're doing and have others do it. It's great for the patients, and it's great for the professional career of a doctor, I think. And as an aside, on the COVID front, one of the things that I've been presented a lot of information. I had access to Operation Warp Speed for almost a year, and we had a presentation. I'll never forget. It was the same day that they presented the Pfizer vaccine data, and they presented zinc 50 milligrams, vitamin C 1,000 milligrams, vitamin D 5,000 international units per day, and the data was just about as good as the Pfizer vaccine. They didn't know that they were both presenting on the same day, but they had almost the same data. So the power of alternative medicine is out there. We just have to recognize it and take advantage of it. Thank you.
Oh, thank you.
Rachel, I see your hand up.
Hi, this is Rachel Gauger. I just wanted to give a shout out to Dr. Jensen. I've been seeing him since '09, and as far as him with integrated health, I mean, it's really helped me. I've had issues with low vitamin D. He referred me to do the elimination diet for my allergies. Turned out I had a bunch of food allergies. Also with the unbound copper, he did tests that regular doctors that I had seen hadn't done them, and got corrected with simply supplements. So I just want to give a shout out. Hi, Dr. Jensen.
Hi.
And
Thanks.
and just the difference with the integrated health as opposed to, you know, like the regular Western, you know, doctor, is that he's willing to not only listen, but do these other tests that maybe aren't as common. So just want to share my story.
That's a great one. And it's always an advantage when the doctor's on your side, kind of the counter of that little description at the beginning. We love to relay that there's a great Simpsons episode where Marge is sick and the doctor comes and says, "You go home today." And everyone's like, "Great, is she cured?" And they say, "Well, according to the insurance company, you are." So it's great to see what you're doing in that regard for sure. Charles, you got your hand up.
A few questions, maybe rapid fire. What about diet recommendations, not just supplements? You know, the veggies that are packed full of this or that. Second is payment. Is it all reimbursed third party or is it cash? What do you do for folks who are short on cash? Do you have recommendations? To say, and I had a third question was maybe what are the nuanced differences between Andrew Weil's program and functional medicine? Everyone has heard of Andrew Weil, especially since he was on Joe Rogan recently, which was great for functional medicine. So 3 questions: food, not just supplements. How do you pay for this? And then number 3, the differences, in these programs, Weil and functional, etc.
Okay. So first one, what was the first one? Was food. Oh, okay. Yeah. So absolutely, food is definitely the best medicine. And so when I was trained by Walsh about helping these conditions like pyrrole disease, the American doctors who are integrative mainly use supplements. The reason why is because of time. It's just they're trying to get the patient better quicker. So we find supplements will be a little faster than food. But you could, for example, instead of giving a zinc supplement, you could say, here's a list of all the zinc foods, eat these every day. And here's all the B6, eat these every day. So you can just completely default to diet. You can use a diet, for example, that will help detoxify patients who have heavy metal issues. I mean, food has done that for thousands of years with no problem, with no drugs required. So there's all kinds of ways you can. I have patients that I have to just default to food instead of supplements. So that's a very valid way. And then the question about how patients pay. I have insurance, kind of the main payers, but I do have people. I have an app that is a telemedicine app. So the patient just inputs their credit card information, and if I don't have their plan or their cash pay, I just bill by like the hour for the patient. So if patients, if patients like have trouble affording, what we do is we do kind of do little blocks of time and just do them like spread out. So it's a little easier to pay, like under $100 here, and then 3 months later do it again. Just in time, spread out the appointments. So and as far as the difference in the programs, that's a good question, Charles. And I've talked with the one of the doctors who's a head of the program at U of A about this. He asked me the same question. In terms of the U of A program, you're really like a generalist for all of integrative medicine. I mean, they teach you everything. It's the most comprehensive program. So you learn all the different systems, medicines, all these different modalities that you can use that are integrative, more than probably any other program in detail. And it's over 2 years, and I think it's 1,000 hours. I mean, it's very, very comprehensive. The functional medicine program is more, it's an approach to try to solve patients' problems using, looking at basically starting with the biochemistry of the patient, the steroid pathway, looking at blood work, looking at the symptoms, and trying to figure out like what's wrong with this patient in how their steroid pathway is working, what's wrong with them, and how their thyroid is working. And it gives you it harkens back to biochemistry a little bit more than the stuff that we didn't think we'd ever have to look at again, we do with functional medicine. So it's a little bit more focused, like problem solving approach. They definitely overlap, but their philosophies are a little slightly different in general. Hope that helps.
Very good. Okay. Well, lo and behold, Dr. Jensen, Doreen is back. There's something else she forgot to compliment you on.
Okay.
Well, it was not only a compliment, but also a thank you, because of your recommendation of my going on to the nutritional supplements rather than getting the vaccinations for the flu or the pneumonia vaccine, that I've been able to successfully not have to deal with pneumonia or the flu the last 4 years. And this is, I think, especially important because when I was diagnosed with that brain tumor at Barrows Brain and Spine Center, they wanted to do that brain surgery right then and there. But because of your diagnosis of my having that immune deficiencies, I asked for postponement, and thank goodness the second opinion at Mayo neurosurgeon decided that we could just monitor it. And so far, the monitoring of that brain tumor has shown that it hasn't grown, so I don't need to risk, the brain surgery. But the treatment protocol that you put me on, as far as the zinc, the vitamin C, and the vitamin D, are exactly what now we're learning is what, has helped people from catching COVID. So thank you.
Oh, you're welcome. Thank you, Dorina.
That's great. Mackenzie?
Hi. Hey, Dr. Jensen. I have one comment and then one question.
Sure.
So the comment is, thank you for taking time with your patients, because before I went to you, I went to a functional doctor who did like homeopathic stuff, and I learned a lot from her, but she was on a time crunch. It was like I had 15 minutes to tell her all my symptoms and explain things, and I just felt so discouraged and rushed, like out of her office almost. So long story short, spent over $1,000 just in a couple months with treatments, homeopathic treatments that I did not feel better on. And she told me you'll feel worse before you feel better. But I just felt like she was in it for the money. So anyways, thank you for when we had our first like telemedicine thing. I know it almost, I think it was like 30 minutes maybe. But I didn't feel rushed, and you were able to answer all my questions, which was awesome. And I really appreciate that.
Oh, thank you. I appreciate that, Kenzie.
Yeah. And then my question, oh, go ahead.
No, go ahead. I forgot that you had a question.
It's okay. My question is about like sunscreen and the sun. So I've heard like, dermatologists and estheticians say, oh, use your sunscreen. And I don't know how, like what your thoughts are on sunscreen. But as far as vitamin D, I went to a Chinese medicine doctor, and he said that you don't need sunscreen. If you just go out in the sun and absorb it, then that's fine for like 15 or so minutes. But then it needs 24 to 48 hours to absorb. So if you shower, then you won't get the vitamin D. So I was curious what your thoughts are on that based on your experience.
Huh. I didn't, the showering thing is new to me. I haven't heard that before, but it is true. I mean, just moderate sun exposure is good. They say that there is an anti-sun lobby out there. So there are a lot of companies making money by selling sunscreen. And what we know is that the most important disease, especially for men earlier and then for women later, is cardiovascular disease. And there was one study published that they found that if they just had everybody be in the sun for 15 to 20 minutes a day, you would actually reduce the incidence of cardiovascular disease through vitamin D. So what's going on now is we're reducing the risk of skin cancer at the expense of cardiovascular disease. And if you do the math, it's better to tell more people to be in the sun than it is to tell them to be out of the sun. And it makes sense. I mean, it makes physiologic sense. Why would, our bodies, why would it do us harm to be out being active? So I agree with the latter doctor more than I do the first two.
Mm-hmm. Okay, great. Thank you. And I also, part of like the pyrrole disease that I was diagnosed with from the DHA labs, talked about like your inability to tan. And I just want to say I was burning a lot. Like I've always been one to burn, but I've been on the supplements like for maybe a little over a month, and I'm tanning well. So That's
Good.
another good thing.
Good benefit.
There you go.
Yeah,
Nice,
for
nice
sure.
side benefit. Perfect. Okay, Andrea. You have to unmute there. Well, maybe not. Okay, she's there, but something didn't happen.
Jeff?
Oh, here we go. Yeah, okay. Hi, Charles.
While she unmutes, I might ask Dr. Jensen, have you had any experience with colleagues or friends from your old MD days that have also dipped their toe in the water of integration?
I haven't. Most of the integrative crowd that I've come to know with my trainings in the last few years, they're all new people. I have had a colleague refer a patient to me because they heard that I did integrative medicine and they didn't know how to help this patient. So, but I haven't had as many takers. The trainings are quite expensive for doctors. Unless they have their own private practice, it can be hard to afford the tuition for these trainings. So I think that's why it's difficult to, unless not a lot of my colleagues have their own private practice, and so they're getting a salary. So it'd be quite a sacrifice for them to do those trainings.
Yeah, they're kind of locked in.
The salary is low enough where that becomes a concern. A new one for me.
Yeah. It's just the tuitions are for each program. It's roughly between about $24,000 to $26,000. So it's a lot, if you have to make quarterly payments, even with a pretty generous salary and a family, and people get used to their income, it's a little bit more of a sacrifice when it's not an expense in the practice. It's a lot easier that way.
Right. Andrea, I
Jeff,
think is back.
If I can finish up, Jeff.
Go, sure.
What do you think about the role of integrated primary care? So many of our colleagues, Jeff and I are mostly in the individual and small group market, but friends of ours, including on this call, listening in right now, deal with the big groups. And the big panacea for them is our DPC arrangements, direct primary care, where you pay a monthly fee for an allopath. We have one of our mutual friends, Ruth Lininger at Duchess Health, wants to have an integrated entry point. With all those thousands of employees, how do you think healthcare would change if they were seeing an integrated doc like you, not just an allopath?
Well, I think that the cost would go down. I think there'd be less money spent on pharmaceutical drugs. A lot of patients opt out of vaccination because they've had either family member or themselves have an adverse reaction. So they're trying to go more of a natural route. So you'd see lower costs. And in the Jeff and I were talking about the Cleveland Clinic. We were mentioning that the Cleveland Clinic is trying to do a model approach, and they're the IFM, Institute of Functional Medicine, set up a clinic there, and they're trying to carry forth a model to show that it reduces costs and publishing their data. So there is somebody out there trying to show that it saves money ultimately to do that type of care, integrative care. And I think it does. It can save patients money, and it reduce visits as well, so that patients don't have to go to the doctor as frequently. So.
Yeah, and reduce severity as time goes forward. They're not going to start developing all these problems. So there's some other savings. I think Andrea's back in game here.
Yes, thank you. Well, first off, I would like to thank Dr. Jensen for all that he has done, not only for myself, but for my entire family. We have now began seeing you, I believe, in 2017, if I remember correctly. And when I came to Dr. Jensen, I was a mere 90, maybe 95 pounds at that point. And I had a number of different health conditions, and one of which had already been diagnosed, and that was Graves' disease. So that affects the thyroid, hyperthyroidism. But we were also up against another giant, and I had the antibodies for the Hashimoto's as well. So ultimately, we had determined that the medication that I was on, being prescribed from the Western medicine doctor, was doing nothing. It was actually making my condition worse, because they didn't realize that my Hashimoto's was prominent at the time, and that my Graves was just kind of dormant. Anywho, long story short, this was pretty shortly after you had come back from the from overseas and learning the Coimbra protocol, and you immediately put me on that. I was able to instantly see a drastic change within my life and my health overall. I was severely depressed, and I had never been through depression and never experienced it. So I was extremely concerned in the beginning and my initial appointment, seeing Dr. Jensen, that I was at my wit's end. I would just cry for no reason. I couldn't care for my children. I was struggling tremendously. And by going on this protocol and then beginning to adjust my diet, instantly started seeing these changes happen within myself. And I can say that since 2017 and that first appointment, and being less than 100 pounds, I've now been able to hold my weight and continuously gain at my own leisure. And I'm sitting at 128 pounds, the healthiest I've ever been in my entire life. And it's a special thanks to Dr. Jensen, who ultimately saved my life. And he's treated my husband and my children, and most importantly, our newest addition to our family, which was our foster son that we have just adopted this past June. And he was, we were able to start getting him treatment from Dr. Jensen at the age of 2 months old. And he was able to help us safely detox him from the exposures to the methamphetamines and heroin and marijuana, everything that he had been exposed to for very long term, as he was being developed in utero. And so we were able to just see this baby flourish when he wasn't. And so, I mean, it's just been life-changing for us. So just wanted to get on here and thank you and congratulate you, and miss you down here, but appreciate your still being readily available at any given time for me.
Thank you, Andrea. I appreciate those kind words.
Well, what a great place to end it tonight. You know, we just ended on a phenomenal high note, and it's a testament to you for sure, obviously, but really to what you're doing. So others like you. You're not a lone wolf out there, luckily, and so this is really exciting to see. So again, thanks for sharing with us tonight.
Hey, thanks for having me, Jeff and Charles, and thanks for everyone being here.